Selamat sejahtera. Hi, good morning all. We are from Group A SKT1013 Introduction to Inorganic Chemistry. Group number 1 that consists of me, Tushitra Sri Armugam, and my friends Yasmin, Felicia, and Nikno Nadia. Today we are going to present about nanotechnology in medicine. So now let's start with introduction. What is nanomedicine? Nanotechnology in medicine involves application of nanoparticles currently under development, as well as longer range research that involves the use of manufactured nanorobots to make repairs at the cellular levels, sometimes refers to as nanomedicine. The term nano means minuscule, extremely small, and nanomedicine deals with drug formulation that have sizes in the nano range. There are devices built with the help of nanotechnology used in monitoring, repair, construction, and control of human biological systems. Nanomedicine describes the highly specific treatment of disease at the molecular level. Nanotechnology has many prospective applications in medicine, ranging from nanosilver paint for bacterial growth prevention to medical imaging and treatment of disease. There are very exciting new techniques being developed to utilize nanotechnology to treat multitude of diseases. Nanotechnology is in fact helping to realize mankind's dream of fighting against many complex illnesses like cancer, multiple sclerosis, cardiovascular disease, Alzheimer's and Parkinson's disease, diabetes, as well as some inflammatory or infection diseases like AIDS.
Alright, now I'm going to talk about how nanotechnology is used in medicine. First is diagnostic techniques. The method uses gold nanorods functionalized to attach to the type of protein generated by damaged kidneys. When protein accumulates on the nanorod, color of the nanorod shifts. Then, the test is designed to be done quickly and inexpensively for early detection of a problem. Alright, number 2 is drug delivery. Particles are engineered so they are attracted to disease cells, which allows direct treatment of those cells. This technique reduces damage to healthy cells in the body and allows for early detection of disease. Number 3 is antibacterial treatment. Techniques to kill bacteria using gold particles and infrared light. This method may lead to improved cleaning of instruments in hospital settings. Next is point number 4, wound treatment. For trauma patients with internal bleeding, another way to reduce the blood loss is needed. Researchers at Chase Western Reserve University are developing polymer nanoparticles that act as synthetic platelets. Lab tests have shown that injection of these synthetic platelets significantly reduce blood loss. Alright, for the last point is cell repair. Nanorobots could actually be programmed to repair specific disease cells, functioning in a similar way to antibodies in our natural healing process.
This part we will discuss about advantages and disadvantages of nanotechnology in medicine or nanomedicine. Okay, the first advantages, from the word nano itself, it means small. So, nanomedicine produces small devices. It makes the treatment easier than use traditional devices which have a bigger size. So, it helps especially surgeons to control those devices inside patient's body. Next, advantage number 2, nanomedicine is a modern technology in medical that allows early detection for the disease. These advantages allows the doctor to detect the disease in early stage. For example, nanotechnology has been used for improving ovarian cancer diagnosis and treatment. Also, it used to earlier diagnosis imaging and screening of ovarian cancer. Last but not least, advantage number 3, nanofiber, which is the example of nanotechnology in medicine, has the ability to repair tissues within the body. In fact, the great development of tissue engineering are scaffolds, which are used to repair damaged tissue. For neurotissue engineering, the submicron or nanoscale fibers, scaffolds that imitate natural cells can repair the damage in those sensitive tissue. Okay, next, in this world, everything has its pros and contrasts. So, the disadvantages of nanomedicine. First, a major drawback of nanomedicine is that nanoparticles have no common feature other than their size. Hence, each particle has to assess individually. Also, change in shape and size can lead to various physical and chemical interaction. For example, a substance that is non-toxic at 100 nanometer can become a toxic material at 1 nanometer or vice versa. So, a little change can give a big impact. To get a better treatment, we have to invest a big amount of money. So, disadvantage number 2, nanomedicine is very expensive because developing it costs a lot of money and these nanotechnology are very difficult to manufacture. This is probably why the product made of nanotechnology are more expensive. We have known that nanomedicine is a very small particle of technology. Since the particles of nanomedicines are very small, problems can actually arise from the inhalation of this minute particle. For example, one major hurdle is the tendency of nanoparticles to cause damage to the lung. Uptake of the nanoparticles through the olfactory epithelium can also take place, leading to epithelial cell injury which can compromise the basic functions of the nose.
Okay, now we move to next slide, which is nanomedicine impacts all fields of medicine. Generally, in the field of medicine, there is a lot of nanotechnology used to treat any kind of disease. For example, genome analysis of cancer cells. Okay, genome analysis of cancer cells is a biochemical laboratory method for the characterization and identification of the DNA or RNA sequence of the cancer cells. Okay, next, diagnostic in vitro and in vivo are the methods of testing the antibiotic sensitivity of bacteria. And for this one, it is one of nanotechnology that has been viral globally, which is vaccine. Okay, the function of vaccine is has an immunization to reduce the risk of getting a dangerous disease. However, medical imaging is also nanomedicine, which used to create image of various parts of the human body for diagnostic. Okay, last but not least, radiation and diagnostic tests such as X-ray, CT scan, and MRI. They are used to help diagnose injuries or illness within the body. Okay, in conclusion, nanomedicine is a branch of medicine that applies the knowledge and tools of nanotechnology to the prevention and treatment of disease. Nanomedicine also involves the use of nanoscale materials such as biocompatible, nanoparticles, and nanorobots for diagnosis, delivery, sensing, or actuation purposes in living organisms.
This is a few references that we use to get the information. That's all from us. Thank you.
Bye.